Governor, the emergency declaration that you asked for last month and that you put in place was extended by the legislature. It's not what you wanted, but it does go through the end of the month. Does that at least give you the flexibility to do what you need in the short term?
Yeah, each of the orders that I have executed come from a variety of sources of power of the executive. And so the legislature's choice to make it a little shorter than what I had asked for doesn't really change the scope of my ability to do what we need to do. It just actually is going to require them to come back into Lansing during what we think might be the peak of the crisis. And that was something I was hoping to avoid because I do care about their safety, and I do want to make sure that we have as few people moving around as possible and able to, abide by the stay-home order.
Now, that was one issue, was the declaration. The stay-at-home order is something else, and a lot of people have been asking if that is going to be extended as well.
It's going to be extended, Rick. We will make an announcement tomorrow on all of the different pieces of the stay home, stay safe order. But what we know is right now we are still on the upward trajectory of COVID-19. And as tough as the sacrifice has been that we've asked people to make by not going to work, staying home, taking our kids out of school, closing businesses, and I know it's taken a toll and I know it's hard, but we also know that we are still on the upward swing, that COVID-19 number of cases is, growing every day. The number of people that are losing their battle with COVID-19 has as well. And it's really important that we continue to double down on mitigation and protecting folks by staying home. So the terms of it, though, you'll be able to see tomorrow. And I think, when I sit with Dr. J and we answer questions, it'll be very clear that this is a step that is still necessary.
When you think about that stay home, stay safe order, we've had a lot of people question what is essential. I talked with the speaker yesterday and he said maybe we need to start thinking in terms of what is safe, maybe not what is essential. But you've been pretty clear that you want this to include as many people as practical because of the reasons you just outlined. So can we expect that it's not going to be a matter of loosening who can go to work, but a matter of continuing trying to keep as many people at home as possible?
Well, I think, Rick, you'll see that the order reflects all of the statements of the epidemiologists and the medical professionals who I think we all should be listening to, frankly. It's easy to think through scenarios where maybe something seems less risky. But the fact of the matter is, the more people that are out and about moving around, the more people at the gas station who pick up that nozzle and fill up their car, the more people that are going to be affected by this. And that's precisely why it's really important that we continue to do what we've been doing, to double down on these mitigation tactics. We know that it's worked in other states that have been confronting this longer. The governor of New York has made some observations to precisely that it looks as though they've been able to flatten the curve. To the extent that we impact making fewer people have to go into the hospital or fewer lives lost, and shortening the amount of time that we'll confront this as an economy is better for everyone. And that's precisely why I listen to the scientists first and foremost as we make decisions about public health.
Where do you think we are on the curve? And I know we won't know probably until we get past and can look at all of the data, but do you think either because of information that you're getting from the medical experts or even anecdotally that we have started to flatten that curve or push it down a little bit, or when will we really know?
Well, I think that's the difficulty here. We've never had enough tests. This is a frustration that we're not alone. The whole country is feeling this. And in order to really have confidence in the numbers and the modeling, you have to know how prevalent COVID-19 is. And I think that's an issue that makes it much more difficult to, with any confidence and accuracy, say our peak is going to be on this particular day. The Trump administration is looking at kind of nationally, what they think peaks are going to be. We're looking at what's happening here in Michigan. And when we talk to our researchers at the University of Michigan, we think that it's closer to the end of the month when Michigan's peak will be. It will be different in different communities across Michigan. And so to really be able to pinpoint one day where it's going to be the worst and then it's going to get better every day after is not something that we're able to do with a lot of confidence. But what we do know is that social distancing works. We do know that the more people that abide by this order, the fewer are going to get sick. The more nurses and doctors are going to be able to do their jobs and have the PPE they need to adhere to and the standards, but also to take care of the people that need their help. And that's why, even though it's a sacrifice, it's on every one of us to do our part. In your household, two people can get COVID-19 and react very differently. One can feel like it was a mild flu, and for the other, it can be fatal. We don't know how our individual bodies are going to react to it. Some people might be carrying it right now and have no idea. And that's precisely why these mitigation strategies are the most important tool that we have in this invisible threat to all of our health.
When you talk about having the right amount of equipment for hospitals and those frontline workers, you talked about PPEs, we know we've talked about ventilators. How are we as a state prepared for this oncoming surge, this getting to the top of the curve, compared to where we were, say, 4 weeks ago when this started?
Yeah, so we've really ramped up. I think that knowing that the national stockpile was not going to be able to meet all of our needs, we mobilized our state emergency operations center, and we've been procuring equipment from around the globe. We've got great Michigan businesses that have stepped up, that have started producing, instead of alcohol, hand sanitizer, or instead of cars, face shield for our medical providers. Each of these helps us meet the requirements for our nurses and doctors to keep themselves safe. We know, sadly, that these frontline professionals, these superheroes that walk among us every single day, are exposing themselves to great risk just by being in the hospital with COVID-19 patients. And that's precisely why we got to make sure they've got the tools to protect themselves so that they can keep caring for patients. So each of these has been an important component to making sure that we're able to meet the need. A week ago, we were living about day to day. In some hospitals we were. Today, most hospitals have 3 to 6 days worth of PPE. Now, that's great. I mean, that's much better than where we were, but that's not enough. And so we've got to continue our efforts on all of these fronts.
Rick, we have time for one more question.
Earlier this week, you had some stunning numbers when it came to unemployment claims. And we know that people are really frustrated about the difficulties they're having getting through to the system. And you express some of that same frustration because obviously you've changed the rules and allowed people who otherwise wouldn't have been able to get unemployment to do so, but the system is overwhelmed. Can you share some of those numbers with us again, just because they were really overwhelming?
Well, I had my notes in front of me, but I'll tell you this. The number of claims that we are getting right now, it's a 4,000% increase from what we were getting 2 weeks before COVID-19 made itself known in the state of Michigan. On a day, we get more people applying for unemployment than we did for weeks during the Great Recession in 10 years ago, over 10 years ago. And so I share these with you because it just shows you that there's so many people that are unemployed right now, and it's been a huge pressure on the system. Now we've rebuilt the system. We've quadrupled the number of people that are working to answer phones to help people navigate it. But when you quadruple the resources and you've got 4,000% increase, you know that it's still going to take some time to make sure everyone's navigated it. Now, acknowledging this and how difficult these times are, I cut a bunch of red tape. So some of my executive orders made it easier for people to get some help. We extended unemployment so they'll get more help when their claim is done. I've made it so that you don't have to file it within a certain period of time in order for your benefits to accrue. That means, you know, the clock, if it takes you a little bit longer, you're going to be okay. You're still going to get the unemployment that you deserve. And then also, we just made it easier so that you don't need to have all of the paperwork that we used to require from your employer. So we're working to make it easier for people, to make it sure that people have got access to additional benefits. It's a harder to navigate right now, but we're working to, you know, address that as well.
All right, Governor, thank you very much for your time.
All right. Thanks, Rick.